Have you guys seen the movie Root Cause? So 100% of root canal teeth are infected. Out of thousands and thousands and thousands of teeth they tested, 100% of the teeth are infected. When they do a root canal, you saw that picture, they just drill down into your root and they leave the tooth just as it is. But that tooth is very porous. There's little tiny microtubules all through that tooth, and bacteria live in those microtubules. They contain mold and multiple strains of bacteria. Streptococcus was found in 92% of the time. It's really hard to kill strep, really hard. In the tooth, 92% of the time they found this strep, which attacks the heart, the nerves, the lungs, the liver, the brain, and the sinuses. When you've heard that, oh, I hear bad teeth can lead to heart attacks, this is why. It's the strep.
All right, everybody hit the like button. Everybody hit the like button. Everybody come on in. Drop your city in the chat. Let me know where you at. Drop your city in the chat. Let me know where you at. Share this video with every human being that you know, because this can help everybody, male, female, cat, dog. There is something that a lot of us do not know, and it has a lot to do with going to the dentist and getting a root canal. And some of you, or most of you, may not be aware that simply getting a root canal can actually cause you to end up with cancer, which actually happened with me in the last live stream I did about me having and beating cancer. And I'm going to talk about that also. I literally talked about how something happened that put me in a position where I had cancer, because I eat right, I work out, I don't drink, I don't do any of these things that other people do. How did I end up getting cancer? Well, it was my dentist. And I'm not saying my particular dentist actually tried to end me. Dentistry itself tried to end me, because they know what they're doing when they're doing it, and they can't tell anybody that they're doing something that can cause you to actually die, because they would be out of business. So there's a show or a movie documentary called Root Cause, and I'm about to play it for you. And they are about to break down virtually everything you need to know about how you can avoid what happened to me. I ended up having cancer some months ago, and I beat it. Everybody drop your city in the chat. Let me know where you at. Let's go.
I actually had my wisdom teeth removed when I was 20. I had no idea. The insurance company had a $5,000 reward for removing my wisdom teeth. And then I learned about how your wisdom teeth are connected to your heart. So there's actually no reason to remove the wisdom teeth.
Your wisdom teeth are connected to your heart. And put a 1 in the chat if y'all can hear me. Looks like something's actually maybe wrong. All right, here we go. All right, cool. All right, put a 1 in the chat if y'all can hear me. I just want to make sure y'all are good, because my chat disappeared and it just came back. Is everything good? Put a 1 in the chat. Make sure y'all can see me and hear me clearly. Okay, cool. All right. So what he just said is very important. He said your wisdom teeth are connected to your heart.
They actually just pulled them out so they could get from the and then mess.
So somehow your dentist extracts your teeth and gets money from the insurance company or something
with your meridian line, which if you think of wisdom, you think of your brain.
And he said the word meridian line. I need y'all to keep that in mind. Your meridian line, your entire body is an electrical instrument. You're just like the wall. When you plug the TV in the wall, you are like the wall. All right. And when they start putting metal into your teeth, you're disturbing your electrical circuit. You are an electrical circuit. Your entire body is built off electricity. And when dentists start sticking metal objects into your teeth or gold crowns, it actually cause your body to go haywire, because it's like sticking a fork into the light socket. And I'm dead serious when I say this. This is not clickbait. I'm not just making up shit. Hit the like button, hit the like button. And then the wisdom teeth are also connected to your
heart. So a lot of times when people get their wisdom teeth removed, they actually start developing heart issues. See how this goes? The meridians of the wisdom teeth are connected not only to the brain, but also to the heart. So then people start developing heart issues and then can't figure it out, but it was because they had a procedure in which it was never supposed to happen, never needed to happen. And remember, the dentist industry is a break-off of the industry. They're fluoridating people's mouths, taking teeth out of them, x-raying them, and all of your teeth are meridian lines. So if you mess with those meridian lines, you mess with all the pathways of the body.
And we're going to show proof of that because, of course, that's TikTok. You might be like, man, this is just some TikTok stuff. Okay, here we go. This is the real shit. Everybody hit the like button. Everybody hit the like button. Everybody hit the like button.
Will get their mind around the fact that their teeth are.
Oh, let me back this up.
Many people have trouble getting their mind around the fact that their teeth are making them sick. But let me just tell you that a year or so ago, we looked at the last 60 cancer patients that we had seen, and 96% of them had an infected tooth in the same power supply circuit as their primary.
You see, he said, same power supply circuit. You hear what he said? He said, power supply circuit.
Primary cancer, 96%.
So let me back it up just a little bit because this little part right here is very important.
In the same power supply circuit as their primary cancer, 96%.
96%. So let me give y'all a little background and we're going to continue into this video. I end up having lymphoma cancer. I had a big old knot on my neck and I didn't know what was going on or whatever. But of course, I went to the doctor. They said I had lymphoma cancer. And one of the reasons I talked about this earlier, well, in another live stream, one of the ways that I was easily, I use that term loosely, easily able to beat cancer is because my attitude towards cancer was, I'm going to be the bully here. You know how they say cancer is aggressive? Well, I was more aggressive than the cancer. Not one time, not one thought process went through my mind that had me thinking cancer is going to take me out. No. My belief system, and this is what I teach to women and men, my belief system says that I'm going to just get rid of cancer just like I get rid of a damn cold or COVID or whatever else. I'm not gonna just get taken out by some bullshit. I own my own body. Shout out to A Hill. You own your own body. Facts. I own my own body. You don't come in here telling me what you finna do to me. No. You know how women love to say, my body, my choice? Yes, that's what I said to cancer. My body, my choice. I'm getting rid of your ass. But I came to find out that the reason why I got cancer, because I don't smoke, I don't drink, I work out on a normal basis, and I eat right. I just got done with a bowl of grapes. And I only drink water. And I'm like, how did this happen? I had a damaged tooth in the back that I never seen about. And I was supposed to get it taken out. So that's actually what gave me cancer. And it wasn't just a damaged tooth. I got a root canal because I had a damaged tooth and I had a root canal. And the root canal was right here. And guess what? My cancer was right here. So I need y'all to think about that. I had a root canal that was right here, and my cancer was right here. It was like this, right? So overall, I got cancer due to the fact that my dentist decided to give me a root canal instead of taking the teeth out. You know how they say, oh, we can save the tooth. No. And if they do take the tooth out, they could turn around and take it out in a wrong way. And they're going to break that down also. So everything you need to literally prevent yourself from getting cancer is in this video. But before we keep going, everybody hit the like button. Let's have this quick commercial break and we'll come right back. Solution that will help every woman watching, regardless. I just came up with a solution that will help every woman watching, regardless of age, regardless of background. Virtually all of us have somewhat the same issues with the opposite sex. But what if I told you the opposite sex isn't the reason why you're having all these problems? It may be the same sex. What am I talking about? And I'm talking to the ladies in particular, your mother. See, in my 7 years of coaching women, the number one thing that I hear in my coaching sessions is her issue or tumultuous relationship with her mother. So what I've done is come out with a card game that will actually help mothers and daughters come back together. See, we can't expect women to just go out in the world and have these great, amazing relationships with men when she didn't have a great relationship with the person that birthed her. We have to get to the source of a woman's pain, her inadequacies, her insecurities, and heal that little girl inside of her before she goes out in the world as a woman. I call Like Mother, Like Daughter therapy in a box. It's 50 questions for the daughter to ask the mother, questions that you always wanted to ask. And it's also 50 questions for the mother to ask the daughter, because we can't get proper communication being one-sided. But when you're able to ask the questions that you always wanted to ask to your mother without her getting upset, without her pulling rank on you, and then she gets an opportunity to ask certain questions to you, the lines of communication are now open. And when women are finally able to forgive their mother, forgive their father, forgive what happened to them, and most importantly, hear her mother's side of the story that she never divulged to you, relationships outside of the household would then blossom. Because for most women, there's a hurt little girl inside of her that never had an opportunity to be seen or heard. And I didn't just create this card game for you. I created this card game for all of us. Because when our women are at their best, we all are at our best. All of the resentment, the lack of being heard, but all that stops when you buy my new Like Mother, Like Daughter card game. Order it now. The link is under this video. Click the link and let's start healing. All right, so let's get to it. Let's get to it. Buy my Deeper Discussions card game, and you can pre-order my new mother-daughter card game. It's called Like Mother, Like Daughter, all in the same link. And my book is actually in that link also. So all you really have to do is go and hit the link, and this is what you will see. So this is what you will see if you click the link that is in the chat or under this video. Here's the card game right here. Here's my Deeper Discussions card game. And here is my book, The Terrible Life of a Beautiful Woman. Visit that link, hit that link, and see what I got there that can actually help you. All right, so let's get back to this.
Those 7 little words. You're going to need a root canal.
What if I could tell you that 98% of women that have breast cancer have a root canal tooth on the same side as their offending breast cancer? That 98% of women that have breast cancer have a root canal tooth on the same side as their offending breast cancer.
So right there, I actually have somebody in my family who presently has breast cancer, and their root canal is on the same side of the breast cancer. So I'll say that again. There's somebody in my family right now that has breast cancer. They're close to beating it, right? They're done with all their chemotherapies. Their root canal is on the same side as their breast cancer. So that means if you have had a root canal, or if you know somebody in your family that has had a root canal, it is very important for you to go to that person and say, hey, you may need to check your heart. You need to make sure to get you an MRI. And on top of that, you may want to get the tooth that you had a root canal in rechecked. And the way you get it checked is you go to the dentist and require a 3D scan of your mouth, not 2D. A lot of dentists, They only have a 2D scan. You need a 3D scan, and get yourself checked out, because this is a real thing. A person can get cancer because they had a root canal, because it happened to me and it happened to the person in my family.
What if I told you that the biggest toxic influence in the body in a chronically ill person is a root canal tooth?
What if I could tell you that the leading authority in cardiovascular prevention, which is Bail and Doneen, does not condone root canals in your mouth because of the bacteria?
Of the people that come to see me with chronic illness, the question is how many of them have a dental etiology to the cause of their illness? I would say almost all of them.
All right, so let me read these comments real quick, because I want to make sure. And if y'all want me to answer a question, make sure to put it in the super chat so I won't miss it, because this is a very important conversation to have. So Prayed Up says, I had a tooth pulled last year and end up in the ER with brain swelling. And we're going to talk about that, because somebody else said, well, if you get your tooth pulled, is it that the answer to the situation? We're going to talk about that, because they have to properly pull your teeth, because your teeth are actually literally connected to the rest of your body. Your teeth is connected to the rest of your body. It's a bone. Wow, we do sometimes delay heart surgery if a patient has poor oral health. See what I'm saying? I had a pituitary tumor 3 years after medical supervision, metastatic. I hired 3 online radiologists to diagnose it in my skull. The focused breast cancer reduced most of it in 9 months. Valerie says, hit a like button, y'all, and drop a comment if you want me to read it. Good evening, Mr. Lego. I'm so glad I caught your show. I've been having problems ever since I had a lot of dental work done. I've been having pain and jaw swelling. I'm going to get it checked out. Thank you for sharing. Yes, your teeth are it's the beginning and the end of your entire life. Your teeth can end your life or prolong your life. What is the alternative to a root canal? We're going to talk about that also. So let's go. Because the thing about it is, I'm playing y'all this video because I am not I'm not a doctor. So I'm just sharing this video with y'all, and I'm sharing all the research that I did with y'all. So I'm not the actual person. The video is the person to ask, because I got every question y'all want to ask it in the chat, but the answer is going to be in the video. But I can help you articulate your answer also. A Hill says, what is the alternative root canal? Just be patient and you'll hear, because they're going to talk about it.
The vast majority of chronic degenerative diseases begin with problems in the mouth, infections and toxins, and it's only until those are addressed that you're going to get any clear positive response with your disease.
I had a gal come in here who was early 40s, very fit.
And thank you for the super chat, A Hill. Thank you for the super chat. I appreciate you, A Hill.
Very nutrition conscious. And she came in here because she had severe, horrible back pain. In fact, the first day that she walked in, she had a 4-pronged cane bent over, and she was on full narcotics round the clock for her chronic pain.
So somebody just said that they had some type of issue, and this is an example of how her tooth is causing her back pain. And just for the record, I'm going to have to stop every couple seconds while I'm playing this, because this is somebody else's video. And the last thing I need is for this whole channel or this video to be copyright struck, or because I'm using somebody else's content. So I'm going to stop it every couple seconds. Y'all just gonna have to get mad at me, because I don't need no problems with my channel.
And what came up on the examination that I did, that she had some inflammation in her jawbone. I said, did you have any dental work done prior to this back pain. And she said, well, come to think of it, I did. I had an infected tooth. I had a root canal done. I had the root canal tooth pulled, and I had a graft put in there, and I had an implant put in there. So I said, let's do an experiment in the.
So the implants are, like I said earlier, your body is like a semiconductor, and there's something called a meridian line, meridian line. Look it up yourself. And your meridian line is literally your electrical circuit of your body. Your entire body is electrical. It's something called a synapse in your brain, and a synapse is actually this space between my two hands, right? And what they do is electricity goes from one side to the other, and that is how your cells actually allow protein into the cell. So your cell is floating around, and there's a protein that looks like this, and it floats around, and it has to be a certain shape in order to actually go into the cell. And the shape of the protein and what the cell actually needs, what actually causes the cell to open up and allow the protein to go in it, is because there has to be a certain amount of positive charges in the protein, and it works with the cell because the cell has a certain amount of negative ions in the cell. And when they get close, it's kind of like a magnet, right? You have a magnet one way, they push away from each other. But if you turn the magnet around, they go to each other. Your cells and proteins operate the same exact way. So the thing about it is, your body, literally your cells, how they operate and what they allow into themselves, because cells actually turn into bone marrow cells, they turn into skin cells, they turn into hair cells, they turn into different things due to what proteins are allowed into the cell, and the cell turns into a bone marrow cell, as an example. So because of this, your body has to always have the proper amount of electricity flowing through it to make sure your cells are operating the same way. Because like I said, you have to have positive ions versus negative ions inside the cell, and then the protein has to be able to coagulate with the ions. So all of this is an electricity conversation. Your body is literally electrical. You know how when you drink water, what do they call them? They call them electrolytes.
Office. I can inject a local anesthetic on that tooth. If your back pain is related to that tooth, and I block the nerve coming from that tooth, it may make your back pain feel better. So
think about what he just said. He's going to block the pain from the tooth to see if her back feels better. And Renee says, thank you for sharing this video because I have to get a root canal. This is good information. Don't get the root canal. And we're going to talk about what to do and what not to do. Do not get that root canal.
Took some local anesthetic and I injected her tooth, and I waited about 15 minutes. And when I came back into the room, she was standing up going like this. I said, how does it feel? She says, it feels 90% gone.
The reason that root canals have an inherent problem is that because we know that nowhere else in the body can we leave dead tissue. Anywhere else in the body, your appendix dies, you have dead tissue that doesn't heal in any other area of the body. We know we have to remove that because it's a haven for bacteria and it's not compatible with health. And the same is true in a tooth. A tooth is a living structure, has a blood supply, has a nerve supply. And so when a tooth dies or becomes infected and we decide to go in and do a root canal, even the best endodontist, a root canal specialist, can do a great job at cleaning out the main canal of any of the teeth. But what they can't get to are all of these thousands of tubules.
So after the root canal has been performed.
So let me show y'all what a root canal actually looks like. Where is the video? All right, here we go. Let me show y'all what a root canal
In
actually
the
looks
movie
like.
Root Cause. So 100% of root canal teeth are infected. Out of thousands and thousands and thousands of teeth they tested, 100% of the teeth are infected.
100% of the teeth, 100% are infected.
When they do a root canal, you saw that picture, they just drill down into your
All right, so this is what a root canal looks like.
root and they leave the tooth just as it is. But that tooth is very porous. There's little tiny microtubules all through that tooth, and bacteria live in those microtubules. They contain mold and multiple strains of bacteria. Streptococcus was found in 92% of the time. It's really hard to kill strep, really hard. In the tooth, 92% of the time they found this strep, which attacks the heart, the nerves, the lungs, the liver, the brain, and the sinuses.
So that's an explanation of a root canal.
Bacteria still reside within the tooth, and now you have this nice, warm, incubated tooth where the bacteria are able to flourish, and now there is no access from the patient's own immune system to the tooth, because in the process of doing the root canal treatment, the blood supply and the nerve have been severed from that tooth, so now the body can't deliver its own immune defenses to help keep the infection in check.
So that's the actual problem with a root canal, because they hollow out the tooth and then they cut off the tooth from the rest of the body, but the tooth is still in there. So now the tooth, like your body can't like fix the tooth, do anything with the tooth, because it's not connected to the body anymore. So you have, it's like a plaza. You know, you ever been to a plaza, you got your hair done and you got your feet done or whatever, and then next door it'll be an empty building or an empty office space or whatever. That's kind of like how your teeth are. Imagine how many rats and roaches are in that empty building next door to the shop that you're going to. If there are no people moving around, if there's nobody cleaning up, and your body is the little people that cleans up all of your issues and your bacteria of your body. But imagine a part of your body like your teeth that is like an empty office space, and rats and bugs and all kinds of microbes are just in there, and there's nobody there to regulate that tooth. It's only going to get worse. If you ever lived in the hood, you already know the worst thing that you can deal with is a next door neighbor that moves away, and all of a sudden bugs and roaches are in that damn house because there's nobody there to exterminate it or to clean up.
70 to 90% of all medical problems.
Hit the like button, 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 and share your comments.
Actually originate in the mouth. The blood supply and the mouth literally will take any toxins via the lymphatic system and take it down to the thyroid, the thymus, the heart, and the rest of the body. So there is a direct connection.
So for example, on the upper side of the jaw, the last two molars and this bicuspid actually connect up energetically to the left breast, and on this side it's to the right breast. And 95% of the time, women who have breast cancer who undergo a thermographic study will be found to have hot spots in the jaw on the same side as that malignant breast.
And I said earlier that somebody in my family presently has breast cancer, and their root canal was on that same side. So we can easily deduce that their dentist is the reason why they have breast cancer.
97% of our breast cancer patients, we tested all these patients, they had a root canal or a toxic situation in the teeth.
Every tooth lies on a specific acupuncture meridian, relates to certain organs and tissues and vertebrae and muscle groups. There was a 19-year-old girl, her first year in college. She had a root canal on a front tooth. That front tooth relates to the kidney and the bladder. She started to have.
So he says your front teeth are connected to your bladder and liver, your liver and your bladder. So each one of your teeth are connected to one of your vital organs, whether it's your heart. Your heart is connected to your wisdom teeth, And according to him, your front teeth are connected to your bladder and your liver. And this is called a meridian line.
Have bladder infections and kidney infections. 3 months later, still suffering from chronic kidney problems and urinary bladder problems, she took the tooth out. And that was the end of the problem.
So if we're looking at the wisdom teeth, we're talking about a small intestine and a heart. As we move forward on the top and we have these molars.
All right, pay attention. If you have any teeth problems, they're specifically telling you which tooth is causing which problem in your body.
So if we're looking at the wisdom teeth, we're talking about a small intestine and a heart. As we move forward on the top and we have these molars, then we're looking at breast, we're looking at thyroid. On this side, we're looking at pancreas. On this side, we're looking at spleen. Then we move forward to the bicuspids and their lung and large intestine. We go to the eye teeth, and it's called an eye tooth for a reason, because
so your eye teeth, I think those are your fangs, if I'm not mistaken. These, yeah, your fangs, I believe, if I'm not mistaken, those are your eye teeth. Miss Let Go, as I'm listening to you and the doctor, I have been having a lot of these problems. Hey, Valerie, that's what I'm here for. That is exactly what I'm here for, to help y'all.
it's connected to your eye. It's also connected to the liver and to the gallbladder. And then these four front teeth, top and bottom, are connected to the urinary tract, to the anal canal, to the adrenals, to the pituitary, to your kidney, everything that's related to that urinary tract.
Nobody who has an abscess in the body would suggest ignoring it, and the same with dental abscesses. The problem is that they're frequently asymptomatic. Most people who come to see me
asymptomatic means no symptoms. Some people may not know that.
Who have root canals, they turn out to be infected, but they're not coming with a sore tooth. Nobody comes to see me with a sore tooth. They come with their arthritis, their fatigue, their cancer, their heart disease, and it turns out when I get a scan done of the root canal that there's bone being absorbed because of chronic infection of the tooth.
Conventional dentistry believes that you should save a tooth at all costs. And if the patient dies, well, that was the price of saving the tooth. They don't.
Wait, what? I didn't even hear that part. Hold on, back up. What? That don't even make no damn sense. Let's listen to this again. What in the hell did she just say?
Being absorbed because of chronic infection of the tooth.
Conventional dentistry believes that you should save a tooth at all costs. And if the patient dies, well, that was the price of saving the tooth.
Why? Who gives a damn about somebody's tooth? So this is what I'm saying. And I just talked to somebody a couple days ago, and they literally had a toothache, and they went to the dentist, and they sent me a text saying, I'm glad they said they may be able to save the tooth. No. That's what these dentists be trying to do. Oh, we can save the tooth. We just going to do a root canal. No, they want your money. See, one of the things that a lot of y'all may not know is that dentists, they get their money, right? They do the root canals, make the money from you and the insurance company, and then turn around and cause you to get cancer or some other type of health issue. And then guess what? Now you got to go to a doctor. And now the doctor is treating you and getting paid off of your health problems. The doctor knows exactly where the health problems came from. It came from when you went to the dentist. But is a doctor ever going to say something? No. I literally went to my doctor and was like, all right, yo, what do you know about teeth affecting your health? He was like, well, I heard about it. You know what? Don't worry. Don't even worry about it. Because I ain't want to get into it, because sadly, doctors don't want to get in the way of dentists, and dentists don't want to get in the way of doctors. And sadly, they all are trying to cause us to have health problems so we can be addicted to some type of drug for the rest of our freaking life. So doctors and dentists are in cahoots with each other because they both are causing us health problems, so they both can continue to make money off of us. But it starts with the dentist.
They don't really come with the concept that you should take things that are dead out of the body.
Dr. Weston Price, who did...
Think about that. Why would a dentist be okay with leaving something dead inside of your body? No other time is a doctor going to say, oh, this is dead, leave it in there, put a crown on it. No.
25 years of research on root canals found that they could cause almost anything, from mental disease to heart disease to arthritis.
So when Weston Price started doing root canals on his patients, he found that a lot of them were getting sick.
So there was a direct connection between the pathogens of these dead teeth, the galvanic currents between the different metals in the mouth.
He said currents. Y'all hear electricity. He said the galvanic currents.
Perfect example, we had a patient with emphysema on steroids for over a year. I tracked it down to a strep infection in the jawbone where he had a tooth removed 15 years prior. Once I got rid of the strep infection in the jawbone, his emphysema totally disappeared. So the mouth is the toxic waste dump that's impacting on the rest of the body.
Data we've just recently gotten shows now that the #1 cause of heart attack is a root canal treated tooth. The reason a root canal is done is you come to the dentist with pain. A tooth hurts.
Everybody hit the like button. The likes are low. The likes are low. Everybody hit the like button. The likes are low. Everybody hit the like button. Right now, everybody hit the like button. And share this video. Share this video. Share this video.
You want to get rid of the pain, naturally. The problem is, in taking out the pain, the dentist takes out the nerve, the pulp, and the blood supply and the connective tissue.
If that tooth is dead, there's no feeling in it, so there's no pain. But there's an abscess, there's an infection there that's active. And if you put probes in there and measure, you will get biotoxins that are among the severest that exist in nature.
Root canal treated teeth can be a silent type of infection. I've taken out numerous root canal treated teeth that looked completely fine on the x-ray.
Hold on 1 second, y'all. Hit the like button. Let's have a commercial break real quick. Share this video. Share this video. Share this video.
How about we meet up at a coffee shop? Hey, how about we meet up at a coffee shop and play this fun dating card game? We'll have fun and see if we're compatible all at the same time.
Ooh, what's the name of the game?
It's called Deeper Discussions.
I'm down.
Okay, meet you at 6.
Fellas, buy this card game. Ladies, buy this card game. Buy about 2 or 3 card games. The main reason why people can't stay together isn't because they don't like each other no more. It's actually because their present family issues come up or their past family issues come up. But when you play Deeper Discussions, you'll be able to understand a person's family issues up front.
This game can be played with either 2 people or an entire group. So have fun.
Question number 1. Name a time when money was the main factor why a relationship went bad.
Deeper Discussions Dating Edition. Again, these cards are good for vetting a potential boyfriend, a potential girlfriend, a potential husband, a potential wife. The texture of these cards are so soft and silky, by the way. Like
they ain't gonna get
really
wore out.
Durable.
A dating card game for introverts who have a hard time asking the much needed compatibility questions. Deeper Discussions, the card game.
And both of my card games are on the same link. Both of my card games are on the same link. All you have to do is click the link and you'll be able to see where both of my card games are. You can get the dating card game and you can get the mother-daughter card game.
Yet after we took that tooth out and cleaned out that socket, we would find a large area of dead bone or an actual cyst or even actual pus and infection in there.
About 95% of dentists have x-ray equipment in their office, which is only 2-dimensional.
All right, here's the thing. Somebody asked earlier about what do we do about all of this. They're about to break that down right here.
Which means when they take the x-ray from here, they can only see width and height on the tooth. They can't see depth. And you might take a picture of a root canal tooth and it looks fine. But if you do another kind of x-ray, it's called cone beam. It's almost like a CAT scan, where you can get a three-dimensional view of that tooth. We very commonly find that these root canal teeth are abscessed. And there's an abscess sitting around the tooth that isn't visible on the 2D x-ray.
Oh man, like these look terrible. There's a cyst here, and there's a cyst here.
I see root canals all the time look great on an x-ray, but they do not test well. They're a real problem for the individual.
All right, somebody said I have to get the mother-daughter card game. The link is pinned at the top of the chat. All the whatever link you see, it says deeper discussions. All of my card games are on that website. Is all in the same place. This is what my website looks like. So all you have to do is click the link and you'll get everything you need from this one link. I didn't want to make it two different links. So you can pre-order my mother-daughter card game right now. And I will say right now, it will behoove you to go ahead and pre-order the mother-daughter card game because it's only $66. When the mother-daughter card game comes out, it's going to be $199. And the reason why is more money than the typical card game because it's so pivotal to somebody's growth and healing process. My card game is literally like therapy in the box. And if you go to therapy, they're going to cost you, but $200 every session. But you can pay $200 and sit down with your own mother and you and your mother, let go of your issues and childhood traumas and fall back in love with each other and get along with each other without going to therapy. Now, of course, you can't take this and just not go to therapy, but I know too many people who just aren't going to therapy. So I created something that is like therapy in a box. So click the link and you'll be able to see all card games and my book. And that's for the person who said they want to buy a card game. All right, so let's get back to it.
Every root canal tooth contains dead tissue, and dead tissue is a haven for bacteria.
We analyzed 87 very well done root canal treated teeth, many of them by endodontists and many more by general dentists. And what we found was that regardless of how well the root canal was performed, by far the vast majority had a high degree of toxicity. There was not one of those 87 that was non-toxic. The toxins are oftentimes the waste material from the bacteria. They can be also just portions, for example, of the cell wall of a bacteria, but oftentimes they're the waste material of the bacteria.
Over 5,000 extracted root canal treated teeth were submitted to Dr. Haley for testing. 100% of them were toxic. 100% of them were toxic. 100% of them were toxic. This was cause and effect, that the root canal simply cannot be sterilized inside the mouth. It cannot be put into a situation where the infection inside the root canal can ever be resolved.
So that means I need y'all to understand, if you get a root canal or if you got a root canal, it is causing some type of health problem in your body as we speak. If you feel great, that does not mean that in another year or another 5 years, you won't end up having something that I actually had. All right. I just beat cancer. So I am here to help you avoid cancer. And how did I get cancer? Because I had a fucking root canal. So I'm here to help y'all avoid what I had to go through. I got all these goddamn doctor bills and shit. And I had to go through all this other stuff, chemo. I'm gonna show y'all what I the whole all that stuff in a minute after we talk about this. But I'm just here to help y'all avoid what I had to go through. It wasn't crazy or terrible, but who the hell wants to have cancer? Who the hell wants to get lymphoma? Who the hell wants to have back problems or whatever, you know, from all these other different things that the people in this video, because I didn't have back problems, but I'm just saying. So I'm here to help prevent what I had to go through.
And it's not sensed locally because the tooth, when you root canal it, you disconnect from the nerve, so there is no more sensitivity, so the patient can't feel the toxic effect, can't feel the death.
The root canal specialists want to protect their procedure. Okay, so they're going to try to reassure people as much as possible, and I don't know what their intent is. I'm not trying to say they're not interested in the health.
I know what their intent is. They probably work for doctor's offices.
Health and welfare of their patients, but they truly believe the root canal procedure is fine, it does a good job, and they don't believe that it's chronically infected. Science shows the root canal is always infected, and the only differentiation is some are a little bit more toxic and more infected than the other ones.
Everyone processes toxins differently. So there are some patients who are able to handle a root canal treated tooth, and their immune system isn't overloaded by that. Yet there are other patients we find who just one root canal has a dramatic effect on their immune system.
90% of all the prostate cancer, they
now we're talking about prostate cancer.
Contain in its tissue the cancerogenic bacteria which come from root canal.
It's important, obviously, if you have a root canal and you're convinced of the information I'm talking about and the science behind it, you want to get it out of your body, you want to have it stop negatively impacting your health. Well, you need to find a dentist who knows what he or she is doing, because it involves more than a simple extraction.
All right, so this is going to be the hard part right here, y'all. This is going to be the hard part right here. Finding an actual dentist that knows what the hell they're doing. So in this part of the show, we're going to talk about the type of dentist to sit down with, the type of oral surgeon to sit down with, and what type of questions to ask them, and what things you need them to do, because pulling out one of your teeth is not going to be the answer. There's a ligament that is under your tooth, and if they don't pull that ligament out along with the tooth, the ligament is literally going to block your body from your mouth. Think about that. Let's go. Hit a like button, hit a like button, hit a like button. And we only got 2 people to pre-order the my mother-daughter card game already. We only got 2 people. We can't get to 10 people. We only got 2 people that pre-order the card game, y'all. Y'all got a mother, or y'all got a daughter, or y'all got a mother and a daughter, or y'all got a sister who has a mother. Y'all don't think this card game will help out? The solution that will help everyone. I just came up with a solution that will help every woman watching, regardless of age, regardless of background. Virtually all of us have somewhat the same issues with the opposite sex. But what if I told you the opposite sex isn't the reason why you're having all these problems? It may be the same sex. What am I talking about? And I'm talking to the ladies in particular. Your mother. See, in my 7 years of coaching women, the number one thing that I hear in my coaching sessions is her issue or tumultuous relationship with her mother. So what I've done is come out with a card game that will actually help mothers and daughters come back together. See, we can't expect women to just go out in the world and have these great, amazing relationships with men when she didn't have a great relationship with the person that birthed her. We have to get to the source of a woman's pain, her inadequacies, her insecurities, and heal that little girl inside of her before she goes out in the world as a woman. I call Like Mother, Like Daughter therapy in a box. It's 50 questions for the daughter to ask the mother, questions that you always wanted to ask. And it's also 50 questions for the mother to ask the daughter, because we can't get proper communication being one-sided. But when you're able to ask the questions that you always wanted to ask to your mother without her getting upset, without her pulling rank on you, and then she gets an opportunity to ask certain questions to you, the lines of communication are now open. When women are finally able to forgive their mother, forgive their father, forgive what happened to them, and most importantly, hear her mother's side of the story that she never divulged to you, relationships outside of the household would then blossom. Because for most women, there's a hurt little girl inside of her that never had an opportunity to be seen or heard. And I didn't just create this card game for you. I created this card game for all of us. Because when our women are at their best, we all are at our best. All of the resentment, the lack of being heard, but all that stops when you buy my new Like Mother, Like Daughter card game. Order it now. The link is under this video. Click the link and let's start healing.
Root canal tooth is only the first step in the solution. Afterwards, we have.
All right, so here we go. This is the first step. Listen to this. This is very important because you got to go to your dentist and talk to your dentist about this. And Valerie says, God bless you, Mr. Let Go. I'm so glad you shared your story. I'm also so glad that you are okay. Thank you, Valerie. I appreciate that. I'm definitely going to get checked out Monday. I'm literally taking notes. Much love. Shout out to you, Valerie.
Well, you need to find a dentist who knows what he or she is doing because it involves more than a simple extraction.
Removing the root canal tooth is only the first step in the solution. Afterwards, we have to drain the area from the bacteria because the jaw bones, they are not like a stone, they are sponges, bones, and the bacteria and the toxins go into these bones too. This has to be drained and treated too.
And this is where I also find ozone gas so indispensable because you can just punch with a very tiny needle. You go into the area and then you inject ozone gas, and that gas will
Yo, this sounds like it might feel good as hell.
Will go off into all the areas off this main tunnel, all the areas where you have infection. It's really interesting because I've had people where we've injected down here and they'll feel the gas travel all the way over to the other side.
Put a 1 in the chat if that sounds like it'll feel good.
Where they'll feel it travel all the way up under the eye. There was no way you're going to do a surgery and clean out a whole person's jawbone. And it's interesting how as treatment goes on with the gas, they feel that area where it's going off into is shrinking.
This jawbone area has a very dense nerve network. These nerves don't relay. You know, it's not like here goes to the spinal cord or somewhere else. These nerves go right into the middle of the brain where the regulation of the nervous system occurs. They're called cranial.
The lymphatic system.
Nerves. This cranial nerve is the biggest one in the body, and it goes right into there. And this is a very delicate and protected area. So that if someone has a chronic smoldering infection with biotoxin in this area, it can affect their brain, the regulation of their brain, their energy, and lots of other things. So the doctor has to be alert to this, because if he wants cures, especially with cancer, you've got to address these. They're big stressors on the body, and they take a lot of immune attention. And if the immune system's like, don't let the toxin get into the brain and kill me, it's letting the cancer cells go here, or men in the prostate.
Y'all hear that right? Let me back that up, because he's telling you exactly how cancer starts right here.
And they take a lot of chronic smoldering infection with biotoxin in this area. It can affect their brain, the regulation of their brain, their energy, and lots of other things. So the doctor has to be alert to this, because if he wants cures, especially with cancer, you've got to address these. They're big stressors on the body, and they take a lot of immune attention. And if the immune system's like, don't let the toxin get into the brain and kill me, it's letting the cancer cells go here, or men in the prostate.
Y'all hear that right?
Or in the colon, you know, the big ones, or in the lung, these are the 4 big cancers.
Your chance for cancer is significantly increased. And it's just spreading out of the ignorance of the so-called specialists that they don't want to accept this fact.
And we now have studies from the Journal of the American Dental Association that show that when you have 1 or more root canals in your mouth, statistically speaking, you have a greater chance of heart attack.
The trick is to try and work out what is causing the underlying inflammation. Dental infections are a big part of that because of the seeding of bacteria from the mouth straight into the bloodstream, then to the coronary arteries.
Every bone in your body is connected to another bone by way of a ligament. Your tooth is connected to your jawbone by way of what we call a periodontal ligament.
All right, this is the part that everybody wanted to ask earlier. Your periodontal, whatever she just says, ligament is what will keep you either sick or alive. When they remove the tooth, they have to take out the periodontal, whatever she said, ligament. Listen to this. Hit the like button, share this video.
Straight into the bloodstream, then to the coronary arteries.
Every bone in your
And I'm not just telling y'all to share the video and I'm just talking. I need y'all to share the freaking video. Put a 1 in the chat if you have already shared this video. Share this video. This should save somebody's life. Put a 1 in the chat if you've already shared the video.
Your body is connected to another bone by way of a ligament. Your tooth is connected to your jawbone by way of what we call a periodontal ligament.
If a tooth is properly pulled, when the tooth is out, the dentist will also take out that ligament.
That part right there is most important. And we all have to make sure that if we did have a tooth pulled, did they take out the periodontal ligament? Because if it's still in our teeth or down in our socket, we are screwed. Periodontal, yeah, periodontal. Share this video, y'all. So only a few people shared the video. Put a 1 in the chat if you've already shared the video.
And if that ligament is gone, that bone will heal in so that there is full bone and you have a restored jawbone. But if the doctor pulls that tooth and doesn't take out that ligament, that space where that tooth was may seal over on the top and be a cavity.
So this means the answer to getting a root canal is to just remove the tooth, but you have to talk to the oral surgeon and say, hey, make sure to pull out the periodontal ligament. And if you don't, I'm going to sue you. That's really all you have to say. You don't have to threaten to sue the person, but say, hey, make sure to pull out the periodontal ligament when you pull the tooth out. And if you don't, because I'm going to go to another doctor and get an x-ray, a 3D x-ray, to make sure you did it correctly.
Periodontal ligament staying in the socket, it prevents communication from the body being able to send the osteoblasts and the osteoclasts to that extraction site and fill in with healthy bone. It becomes a barrier.
And it will be a place where the body then will use as a storage depot for junk, toxic junk, bacteria, funguses, and it won't hurt. It may not be completely visible on a regular x-ray, but it is sitting there.
So the periodontal ligament prevents healing. One actual study on 5,000 cavitations left after wisdom teeth were removed, 4,999 had not healed. Only 1 in 5,000 had healed.
1 in 5,000? So if that ligament is not pulled out, you are screwed.
The majority of people in the United States and in the developed countries around the world that have had extracted teeth for any reason also have cavitations. And what's inside that hole is nothing different. And this sounds disgusting and it sounds like an exaggeration, but it's not. It's the same as wet infectious gangrene.
These cavitations in the jawbone, they can create significant diseases, significant neurological diseases, like, for example, MS.
For instance, a person could have a clotting disease, or they could have had it.
Now he just said MS. So you can end up with MS, cancer, all these different things, all because of your teeth.
A football injury, something that made the bone not be healthy in that particular area. The most common reason is that the tooth was removed and the periodontal ligament was not taken out, and the periodontal ligament was not taken out, and the periodontal ligament was not taken out, and therefore that void of where the tooth was never did fill in appropriately with healthy bone. The second most common reason is that that bacteria that's in a root canal tooth will find a microfracture through that particular root surface and kind of wormhole through the bone and create a void. And so it's not uncommon for a cavitation to occur next to a root canal. The most common spots are the wisdom teeth.
The wisdom teeth are unique in that there are 4 circuits going through it instead of just 2. It's heart.
Keep in mind, how many times have y'all heard the word circuit in this video? Your body is an electrical circuit.
Small intestine and the sympathetic and parasympathetic systems. And so you see people whose adrenal glands are not working, and it's because they have infection where the wisdom teeth were taken out, because you can have infections in the bone where your wisdom teeth were taken off for 50 years and essentially have no pain there, but it completely destroys your life. When you don't have enough adrenaline, you have trouble going to sleep, and then you have trouble dealing with stress. And then it gets to where you can't stand any stimulus, so you don't like loud music, you don't like loud noises, you can't be around a rowdy crowd, you can't be around people who are arguing. Now, what I just described is a person whose life's in the toilet.
For instance, I myself had my wisdom teeth out when I was in dental school. About 30 years later, I developed a heart arrhythmia, and nothing seemed to help it. I would take intravenous vitamins, I tried homeopathics, nothing was doing it. And all of a sudden I said, wait a minute, let me check, see if I have a cavitation. That wisdom tooth, which is on the heart meridian, you see, was causing the problem.
If you can get a good normal 3D cone beam x-ray of your jawbone, then you do have a much higher reassurance that you don't have this cavitation process going on inside the jawbone as well.
And if the dentist unroofs that and scoops that stuff out and then removes that ligament and then that heals, that patient can get well.
One of the biggest things that you can do is to have proper nutrition, be eating a clean diet, be getting enough proteins and enough vitamins and minerals.
When that tooth comes out, you want to make sure that the socket is cleaned out really well. You want to remove the periodontal ligament. If there's infection, you want to get rid of the infection, and then you let it heal. I like to let the body fill it in with its own natural bone. You have to wait at least 3 months for that. You want to check it and make sure that it did heal, that you don't have the cavitation.
This means we got to spend a lot of time at the dentist, y'all. We can't just go to the dentist every now and then just to get our teeth clean. We actually have to spend a lot of time in the dentist, and we got to spend a lot of time having conversations with our dentist so we can get an understanding of what they're doing. Because if we don't let them know what we need them to do, they're going to half-ass it, and then they're going to actually make our situation even worse than it actually is.
Well, let's say it's healed. How do you replace the tooth? Well, you have different options. Of course, an option is you don't replace it, you leave it alone. Another option is you can use something removable, which most people don't like. It's not very comfortable. The other option is you could put a bridge in, where you're bridging that space. And there are 2 types of bridges. The traditional bridge, which I don't like, is where you have to mutilate the teeth on either side of that space to hold the missing tooth. And the problem—
What's up, Miss Locks?
With that is, when you mutilate those teeth, you increase the odds that those teeth could need a root canal in the future.
See how things just get worse and worse and worse? So to all the people who got veneers, you got to be careful in what doctor or dentist you go to, because you could turn around and cause a problem by just simply getting veneers.
So I prefer to use a bonded type bridge, where the abutment teeth, as they're called, or the supporting teeth, have minimal preparation, and that holds the missing tooth. Now, the only downside with that really is that it periodically will come loose and need to be re-cemented.
What we're finding is that many physicians that are referring their patients here, and also patients that are doing their own research, are desiring to have no metal in their mouth. They want to eliminate anything that could create a current, and that's why we now have zirconia implants, which is, it's more like a ceramic. It's a complete non-metal implant that looks the same as a titanium implant and functions the same, but is considered much more biocompatible for the tissue and for the patient.
Root canals are probably one of the most pernicious, toxic, hidden influences on your health. And if you're struggling to understand why you're so sick and you have multiple root canals, please examine that issue.
Currently,
we have roughly 25 million new root canal procedures being done a year in the United States. One of the greatest public health interventions we could possibly do around the world is to make it very clear the important role that dental infections and toxins have, and hopefully someday to make the root canal procedure something of the past, because it does nothing positive for the general health of the body at all.
So what questions do y'all have? We're going to talk about my cancer situation in a second, but I just want to check to see what questions do y'all have. Was that actually helpful? And why have y'all not contributed to the channel? So Cash App is $AARON 1000. Contribute to the channel. Contribute to the channel. I'm waiting on the next video to download. Is at 99% now. So let's see. So it's almost done. But what question do y'all have? How about those metal spacers? I would say, see, there's one thing about a metal spacer, and the metal is in the actual fake teeth versus a piece of metal that is drilled down into the hole of your root canal that is now a part of your circuit. And your circuit is actually called your meridian line. So I don't know about the metal spacers, but all I know is when something is drilled down into your teeth that is metal, that is the biggest problem. So some of y'all did not see this. Here is my cancer documentary right here. All right, so we walking in now, and one thing I want to say, and this might sound crazy, and I have cancer in this video right here. See, but you can't be a bitch when you're going through something like this. And you might look at me like I'm crazy when I say it, but think about it. The worst thing you can do is start crying and whining, saying, why me? Nigga, why not you? So shut the fuck up and do the work. And if you're healthy like I am, you'll beat this shit with no problem. So the thing about it is, the reason why people get so worried is because they were already about to die before they got cancer. They was fat, had all these problems, all these issues. They was stressed out. I'm not stressed out, so I ain't worrying about it.
So you just got your port.
Mm-hmm.
And
They did surgery like on some Iron Man type of shit. They had to open up my chest, so I literally have right here. It's a port, right, and it goes up through my throat.
Okay.
You probably can see it. You see it?
No, just don't turn so hard. But she's bringing back something.
Huh? Oh.
She's bringing some crackers.
Oh, thank you. Thank you. Have a good one.
And he comes in the car smiling.
Yeah.
And he asked that lady right there to tell me how much of a what?
Of a man I was. Because they was like, do you need sedation? I'm like, no. Like,
did it hurt though?
Huh?
Did it hurt? Was it uncomfortable?
Yeah, it hurt. But the thing about it is, all this stuff is gonna hurt.
Right.
And that's the thing. Like, we can't keep going through life thinking that we're not gonna feel pain, right? So I didn't want sedation and all this other mess, because I don't see, the more chemicals or crap that they try to give you to numb the pain and all this other stuff, you're gonna end up getting sick and all this other mess, right? So you just gotta deal with it, you know?
Right.
So yeah, I didn't take any sedation. We were sitting around talking about the Godzilla movie through the whole time.
Right.
You know, and yes, it did hurt. It was like pricking, and they literally had to cut my part of my chest open. Like, it's literally a thing in here, right? It's like this big.
Right.
But they just numbed it a little bit, but I ain't gonna be put to sleep so they can play with my butt or something? Like, no.
Okay.
So we just, sat around and talked about Godzilla movies and stuff. Like, we was chilling. It was music playing and everything.
All right.
Like, it ain't that bad.
Okay, cool.
Stop being a pussy. So here's the incision, and here's the actual thing. And this is the actual lump. Of course, I gotta get. And somebody asked about the link to the actual video, the root cause video. It is in the description box. Just go under this video, and it is in this description box. Chemotherapy tomorrow, right? We were just talking. Do you know that this is the best year of my life? You said I have an amazing attitude. Yeah, but I'll have more of an amazing attitude if more people bought my car game. I just came up with a solution that will help every woman watching, regardless of age, regardless of background. Virtually all of us have somewhat the same issues with the opposite sex. But what if I told you the opposite sex isn't the reason why you're having all these problems? It may be the same sex. What am I talking about? And I'm talking to the ladies in particular. Your mother. See, in my 7 years of coaching women, the number one thing that I hear in my coaching sessions is her issue or tumultuous relationship with her mother. So what I've done is come out with a card game that will actually help mothers and daughters come back together. See, we can't expect women to just go out in the world and have these great, amazing relationships with men when she didn't have a great relationship with the person that birthed her. We have to get to the source of a woman's pain, her inadequacies, her insecurities, and heal that little girl inside of her before she goes out in the world as a woman. I call Like Mother, Like Daughter therapy in a box. It's 50 questions for the daughter to ask the mother, questions that you always wanted to ask. And it's also 50 questions for the mother to ask the daughter, because we can't get proper communication being one-sided. But when you're able to ask the questions that you always wanted to ask to your mother without her getting upset, without her pulling rank on you, and then she gets an opportunity to ask certain questions to you, the lines of communication are now open. When women are finally able to forgive their mother, forgive their father, forgive what happened to them, and most importantly, hear her mother's side of the story that she never divulged to you, relationships outside of the household would then blossom. Because for most women, there's a hurt little girl inside of her that never had an opportunity to be seen or heard. And I didn't just create this card game for you. I created this card game for all of us. Because when our women are at their best, we all are at our best. All right, so somebody said, Miss Locke said, sheesh, Mr. Let Go. You have to have cajones, as in balls, surgery without sedation. Yeah, I'm not getting no sedation. I'm going to be talking to you why you are working on whatever you're working on, because I don't know your ass. I'm not gonna have no strange ass person putting me to sleep so they can do whatever they want to do with me. No way in hell. So I don't do sedation. I did sedation one time before, and I got sick when I got home, and I ain't go through all that shit. See, most people are afraid of pain, and pain is a part of life. So I got a vasectomy. I didn't get sedation. They cut my chest open to do the port. I didn't get sedation. Just numb the area and be quiet. Like, I've gotten teeth removed. I didn't get sedation. I just got it numbed. So they're numbing the thing, but they're not putting me to sleep. So I'm not saying that they're cutting my chest open and there's no drugs. They're just putting it on here instead of putting me to sleep. So there's not, it's just sedation is sleep. Numbing is a shot. So I get numbed. So I just wanted to make sure I ain't crazy. This year, I was diagnosed with cancer, but because of all the things that went on in 2023, it is so much bigger than the cancer. It makes this year the best year of my whole freaking life. Wow. That's crazy. All right. Had my cancer treatment, right? It's about, I think, 7:30 right now. And this is what's crazy. My lump is smaller already. You may not be able to tell, but the lump is smaller already after my first cancer treatment. Day 2 after chemo. It's Saturday, got chemo. Thank you, Mimi. Thursday. Feel great. About to go to the gym. Yeah, I said it, going to the gym. As you can see, shit is almost gone. And I am already expecting abuse allegations to come up because I am abusing cancer. But I expected this. I never at one time thought, oh my God. No, that's not how I think. See, the thing that cancer feeds off of, it feeds off of sugar, glucose, and it feeds off of stress. And it feeds off of you being a bitch. Forgot about that part. Worry. In all honesty, and everybody's situation is different. So I don't want to say all you have to do, but I'm just going to use the term loosely. All you have to do is not worry, because cortisol starts flowing through your system when you start worrying, and it makes your immune system worse. So in a lot of cases, the person is the biggest problem and not the cancer. Right. When you're a bitch, see, the cancer is hoping that you're a bitch. And then because when you're a bitch, the cancer can take over your whole body. And this is not me making fun of anybody who has lost their life from cancer. I'm just being funny. But for the people who have never had cancer, you can't be a bitch and think you're going to survive cancer. That's what I'm saying. I don't give a fuck about no damn cancer. Cancer can kiss my ass. And if you have that attitude, you'll have these types of results. So I ain't studying this shit. I'm out and about doing my thing. I got my N95 mask, you know, so I'm gonna be safe. But I ain't studying this shit. This was me going to the gym a day after chemo. No, I think 2 days after chemo. 2 days after chemo. The shit is almost gone. So I'm here with my doctor that actually saved my life, you could say. And I just wanted to ask him some questions about his thoughts on how I was operating when I had cancer when I first came in here. So what did you see when I first came? What was my attitude or your thoughts? I just changed this. God. I fixed it. Because I didn't trust. God damn it. Oh, here we go. Hold on, y'all. It's gonna stop. I don't know what the hell is going on. Just let it go and it's gonna stop.
Do I really need it? Or can I go with time and things like that? And then you also wanted to do the least amount of treatment which is allowed, and you want to see how it does. Basically, you were apprehensive, but once we had a relationship, after that you said, whatever you tell me, give me a reasoning, show me the proof, talk to me and guide me.
Yeah.
Then I had tried to send you to other doctors to see second, third opinion to give you more thought process because we don't know anybody.
Mm-hmm.
But then after some time, when I showed the proof with the scans and everything, you saw
Mhm.
the reasoning and you saw the lump becoming smaller, you realize that it was doing the job.
Yeah.
And then we were good after that.
And the most beautiful part about this is this. Every time I come in here, he just pulls out his computer and just shows me all the information. So sitting here wondering what's going on, and that the actual clarity. Do other doctors do that? Because the clarity was amazing.
I think every doctor has their own style.
Uh-huh.
What I've seen is that you have to tell the patient as if it's what you want to hear as a patient.
Mhm.
If you explain to them, they'll understand. I don't know how many people. I think also it depends on how busy the doctor. If you become too busy, then you'll not do a good job. So
Mhm.
you have to balance your number of patients.
Yeah.
So,
Yeah.
so I think I don't know about other. I've not gone to other
Yeah,
schools, but
yeah.
you know, I hope they do it.
Yeah.
You know. So.
But I just wanted to thank you for all of your work, because it wasn't just how y'all helped me, but it was the patience and the clarity that just really helped me trust the whole health system, you know? So yeah. Thank you.
Thank you.
On your Instagram, you better post me on Facebook type shit. No, I'm just kidding. Thank y'all, man. We appreciate.
And this is me right back on tour with cancer. This is my merch table when I'm on tour.
We got more contestants, y'all. And I'm giving away a free Rich Auntie shirt with a tote bag and some of my mixes, all right? For the most turned auntie. Are you scared? That's crazy.
Where you going?
That's crazy. Y'all ain't scared, y'all. Hell no. What's your name? What's your name? What up, Ginger? Let me Ginger real quick. Hell no. Hell no. Aunties are ready. Listen to this track, bitch.
Gotta get rid of the music, y'all. So hold on. We have an auntie off. And this is me rock climbing with my daughters. And look how my child just beat the hell out of me in rock climbing.
Oh. Aaron's getting left in the dust. Will he make a comeback, or will he lose to his daughter? Woohoo! Now you gotta make it down.
So she beat me going up, but I beat her coming back down.
Set, go. Come on, Hannah, you got it. He's old, get him. Come on, Hannah, no. You let an old man beat you, Hannah.
All right, we was about to have a couples advice hour, but there wasn't a lot of couples today.
No. So where they at? Why they not representing that investments? That's a little suspicious. What you thinking, Aaron?
I think there's a lot of people out here cheating.
So investments full of people trying to level up, not only in their investments but in their mates too.
So let me give you some relationship advice.
All right, what we doing?
Ask me a question. Let me give you some. How am I attracting this group of people? You got to look at yourself and not the group of people. But as you can see right here, my neck is back to normal and I'm back outside. No?
All right. Well then, I must have a sign on the back.
Or a sign on the front. All right, y'all. So I hope that this was something that was helpful to y'all. I may do a part 3, but overall, I think y'all get the gist of all of this. Take this video and send it to your mama, send it to your sister, send it to your cousin, send it to your brother, send it to your uncle, because I'm telling you now, there's somebody in your family with something growing inside of them, and they don't know that it's growing inside of them, and you're the only person that can save their lives, because they don't know this stuff. So I am informing my community to let my community know how to save their community. Because I can't talk to your mama, cousin, sister, brother, co-worker, best friend. You the only one who could do that. So I'm giving y'all information, and along with that, I'm giving y'all actual tools where you can change your lives and, become better people, Already sent to my daughter. Shout out to Mimi. That's what's up. Yeah, because everybody has tooth issues. Everybody goes to the dentist. I would say everybody has had a root canal. So that means everybody is in danger of having some type of heart disease or cancer. So that's what I'm here to do. And this wasn't a popular video, and I didn't expect to get a whole bunch of people watching, but these videos right here are more important than all the, I know y'all want to hear about all this other shit or whatever, but it's certain times that we have to come together and have these important conversations. Make sure y'all have a doctor that works to heal. My doctor is a scientist. He knows me. He shows me data and everything. Exactly. And Mimi says, thank you. Thank you ever so much for sharing. Your loving kindness is a beautiful thing. I appreciate that. So I'm out of here, but before I go, make sure to contribute to the channel via super chat, Cash App is $AARON 1000, and or buy my Deeper Discussions card game, and or my Like Mother Like Daughter card game that is on pre-order. And if you wait to buy my mother daughter card game, you're going to be mad, because then it's going to be $200. Then you're going to be whining about why it's so expensive. And it's going to stay expensive because the things that I have to offer are some of the things are free and some of the things are expensive. So talk to y'all later.
I would meet up at a coffee shop and play this fun dating card game. We'll have fun and see if we're compatible all at the same time.
Ooh, what's the name of the game?
It's called Deeper Discussions.
I'm down.
Okay, meet you at 6.
Fellas, buy this card game. Ladies, buy this card game. Buy about 2 or 3 card games. The main reason why people can't stay together isn't because they don't like each other no more. It's actually because their present family issues come up or their past family issues come up. But when you play Deeper Discussions, you'll be able to understand a person's family issues up front.
This game can be played with either 2 people or an entire group. So have fun.
Question number 1. Name a time when money was the main factor why a relationship went bad.
Deeper Discussions Dating Edition. Again, these cards are good for vetting a potential boyfriend, a potential girlfriend, a potential husband, a potential wife. The texture of these cards are so soft and silky, by the way. Like
they ain't gonna get
really
wore out.
Durable.
A dating card game for introverts who have a hard time asking the much needed compatibility questions. Deeper discussions, the card game.
The solution that will help every woman watching. I just came up with a solution that will help every woman watching, regardless of age, regardless of background. Virtually all of us have somewhat the same issues with the opposite sex. But what if I told you the opposite sex isn't the reason why you're having all these problems? It may be the same sex. What am I talking about? And I'm talking to the ladies in particular. Your mother. See, in my 7 years of coaching women, the number one thing that I hear in my coaching sessions is her issue or tumultuous relationship with her mother. So what I've done is come out with a card game that will actually help mothers and daughters come back together. See, we can't expect women to just go out in the world and have these great, amazing relationships with men when she didn't have a great relationship with the person that birthed her. We have to get to the source of a woman's pain, her inadequacies, her insecurities, and heal that little girl inside of her before she goes out in the world as a woman. I call Like Mother, Like Daughter therapy in a box. It's 50 questions for the daughter to ask the mother, questions that you always wanted to ask. And it's also 50 questions for the mother to ask the daughter, because we can't get proper communication being one-sided. But when you're able to ask the questions that you always wanted to ask to your mother without her getting upset, without her pulling rank on you, and then she gets an opportunity to ask certain questions to you, the lines of communication are now open. When women are finally able to forgive their mother, forgive their father, forgive what happened to them, and most importantly, hear her mother's side of the story that she never divulged to you, relationships outside of the household would then blossom. Because for most women, there's a hurt little girl inside of her that never had an opportunity to be seen or heard. And I didn't just create this card game for you. I created this card game for all of us. Because when our women are at their best, we all are at our best. All of the resentment, the lack of being heard, but all that stops when you buy my new Like Mother, Like Daughter card game. Order it now. The link is under this video. Click the link and let's start healing.